Global hot zones, the coronavirus spreading.
Fears grow of a global pandemic.
A huge spike in cases in Italy.
Hundreds of cases in South Korea. New cases reported in Europe.
The CDC warned Americans to be prepared here at home, that it's not a matter of if, but when.
Hello viewers. First, I would like you to notice that the stay health experts have been telling that COVID-19 is an asymptomatic transmission, which means a virus in a human being can be more than 14 days without any symptoms, and also it transfers from one person to another. But the politicians downplayed without knowing the consequences and keeping the people's life at stake. One thing the world leaders learned from China is how to handle the crisis within the country. It is to listen to the advices given by the health officials and also the scientists. There were 4 things to be followed. First, social distance. Second, restricting traveling, either domestic or international. Third, intensive testings and quarantine. And fourth one is very important, to be complete lockdown. Although many countries look like following these advices, but only few are able to success on COVID, like South Korea and Taiwan.
Korea ramped up testing around the country. Private and national healthcare systems joined forces to set up a mostly free testing effort that includes more than 600 locations that screen as many as 20,000 people per day. Through this system, when anyone tests positive, the government is able to test and trace their contacts to continue to break the transmission chains of the coronavirus on a large scale.
What went wrong with other countries? Let's find out. As expected, partial travel bans in only infected countries didn't work enough. Then the leaders started full travel bans, but also they failed at 2 points. 1. Not giving proper time and information to the passengers, and 2. Expecting national citizens. As a result, the passengers started in line, which made panic.
To keep new cases from entering our shores, we will be suspending all travel from Europe to the United States for the next 30 days.
Passengers from the United Kingdom and several other countries in Europe has come into effect from today. The ban is on incoming travelers from most notably the United Kingdom, European Union, Switzerland, Turkey, Iceland and Norway. The curbs were announced by the government as part of preventive measures, but it has jeopardized the travel plans of hundreds, perhaps thousands of Indians, many of them students. With work from home mode coming into effect and classes going online, Indians in the United Kingdom who were set to visit home are now left stranded as a result of those travel curbs that have come into effect from today.
WHO on 11th March have declared that coronavirus is a pandemic disease. One important factor the world realized is no country is prepared for a pandemic in terms of healthcare requirements.
March saw Iran and Italy suffer dramatic increases in infection numbers. Iran's health minister was one of the first public officials to be visibly sickened by the disease.
Tonight, Italy reporting a devastating new death toll. At least 793 people succumbing to the virus, its biggest one-day jump. More than 4,800 have died. The scenes in hospitals horrifying as overworked doctors struggle with this wave.
With increasing in COVID patients, the world leaders have taken serious actions like complete lockdown. It is the best decision taken by any leader, especially in democratic countries.
आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है.
Enough is enough. Go home and stay home.
Many national and international events have been postponed indefinitely. In fact, in Hungary, the national elections have also been postponed. But again, politicians are unable to execute lockdowns. For example, in US, instead of federal, state had the authority to take decisions. While in India, only a 4-hour prior notice of 21 days lockdown led many migrants left no choice but to walk hundreds of miles on foot. On the other hand, in Europe, few countries like Poland, Czech Republic closed its borders earlier than others and asked people to stay at home, whereas UK did not even shut down its schools or offices. In Middle East, countries like Iran, Saudi Arabia, Kuwait were failed to implement lockdowns early enough despite their high number of COVID positive cases. Many African countries, including South Africa, Nigeria, Zimbabwe, were locked down only by the end of March or early April. There are two important factors of public restrictions or lockdowns which made people frightened and politicians to fail execution. That is number one, healthcare facilities. Providing personal protective kits for doctors, nurses and police, and also doing enough tests for knowing number of positive cases. And number two, food security and financial. Helping land labor and giving proper needs for the poor people like food and water, and for general people giving clarification in fees, salaries, loans, etc. In fact, complete shutdown gave time to governments to improve healthcare like manufacturing and exporting PPEs, ventilators, test kits, etc. and also to stockpile goods and services needed. There are some politicians who doesn't know about science and spread false statements and misguide public even today. We have entered into a new era where every politician have fan following and we doesn't think and follow what other politicians says. It isn't a problem? Then how do we convince people?
The number of cases of COVID-19 is on the rise in the United States, but so too is misinformation surrounding the virus.
Yes, among all, there is one person who could not control his thoughts and pretend to have common sense. I hope you guessed correct. It's US President Trump.
Because of all we've done, the risk to the American people remains very low. It's absolutely critical for the American people to follow the guidelines for the next 30 days. It's a matter of life and death.
Based upon their interaction with the patients, their assessment of the risks and benefits, can write a prescription for hydroxychloroquine if they think it's appropriate for the patient.
I've seen things that I sort of like, so what do I know? I'm not a doctor. But I have common sense. 61% of the voters approve of Trump's handling of the coronavirus. Number one on Facebook. Did you know I was number one on Facebook?
When a person representing a country or a state, especially a leading country, should not just talk without any basic knowledge. Thankfully, due to increasing technology, many people are hopefully getting to know what are real facts. For example, the interview given by scientists or professionals in electronic media or social media. The main problem came by the politicians is either lack of diplomacy or over-diplomatic. See, in this crucial time, every politician needs to work properly and responsibly. They should not think it's just a problem of one state or one country. It should think a global issue. Countries need cooperation. Then only we can overcome this crisis and fight against corona.
Put politics aside, stop the partisanship, and unify together as one nation and one family.
I want to thank everyone on the NHS frontline, as well as care workers and those carrying out essential roles, who selflessly continue their day-to-day duties outside the home. That what you do is appreciated, and every hour of your hard work brings us closer to a return to more normal times.
On the bright side, COVID-19 made people to stay at home, which caused dramatic environmental advantages like decrease in air pollution, non-renewable resources like oil, gas, etc., and brought freedom to animals and made people get together not physically but emotionally. On the final note, for people, for you and me, we have to analyze this current situation despite the political decisions and to use our common sense. So please think before we act.